I'm Sarah Ling, and I'm a family physician at MercyOne in Waukee. I have always wanted to be a doctor from a very early age, and I also have loved the sciences. And so medicine seemed to be a really good way to combine my interest in science to do something practical and helpful for people. So that's why I got into medicine originally. And the path that I took to get to medicine, I went to St. Olaf College to pursue an undergraduate degree in biology with biomedical studies as a concentration to really gear me up to be a medical provider. But then when I was a senior in college, I had the opportunity to study abroad in South India. And I served and conducted my own research at a leprosy clinic. And that really shaped my life as a provider and actually fueled my interest in public health. And so after college, I pursued a master's in public health in epidemiology at the Colorado School of Public Health. So I spent some time in Colorado, skiing and snowboarding was part of it. But there, as learning about epidemiology, that's the study of how diseases affect populations. And actually that has come in unexpectedly, handy in the middle of a pandemic, where I feel like I've been equipped to be able to process what's going on and read the studies and understand the data and be able to appropriately communicate that with patients. So that's been nice to have. So after that, my husband, who, I married my high school sweetheart. So he said, "You always wanted to be a doctor, so why don't you do it?" And so we moved back to the Midwest to be home, close to family. And I went to Des Moines University for my 4-year medical degree, and then completed my 3-year family medicine residency at Broadlawns Medical Center. I've been working at a rural clinic for the last 4 years, and I'm very excited to be part of the Mercy Waukee team now. I knew family medicine was the right area for me. I love to be able to provide care to the entire family, and I really feel like that's the best place to provide care. And so I get to work with newborns and toddlers, adolescents, men and women with any kind of health issue, and the aging population as well. And it's, a really special part of my job to be able to help people transition in life for end-of-life care, to consider nursing home, in-home health, or hospice. Those are hard conversations, but they're important. So that's what I enjoy about it. I love family medicine and my job because there is never a dull moment in the clinic at all. There's a lot of variety. So I might start the day seeing someone with a sore throat, and then go see a 6-month-old for a newborn check, and then do a skin biopsy and talk with them about hypertension and diabetes. And then suddenly someone comes in with chest pain, and I have to figure out, well, do they go to the ER or do they stay here? So it's exciting. And I also very much value the relationships with patients and families. That's one of the most rewarding parts of my job. First and foremost, I care about you and your health, and I am concerned about the things that influence that as well. And I think those are important. Secondly, coming from more of a public health background, I feel like preventive care is very important. So preventing diseases and identifying diseases early on, and trying to encourage people to make lifestyle choices that really help them. And lastly, I consider it a privilege to be a doctor, and I do not take lightly how much information is shared in that relationship. And I value the patient relationship. And there's not going to be judgment from me. It will be, open, honest communication. And I think that's the best way for people to heal.